Welcome to our video on Raynauds. This is a condition of the fingers and extremities, and we'll talk you through all of those aspects. It's when, on exposure to either cold or stress, patients can get severe discoloration of their digits, or ears, or nose, or toes. Any of the extremities can usually go bright white first, and then they may go blue and or red. So that biphasic, either 2 color changes, or triphasic, 3 color changes, is really typical of Raynauds on exposure to either cold or emotional stress. And that's caused by spasm of the small blood vessels in the peripheries. And those spasm kind of too quickly. Most people, if you're exposed to severe cold for a long time, their body shuts down and their body takes blood away from the peripheries to preserve your heart. In Raynauds, that happens too quickly. It's common in young women. It occurs in about 10%. So 1 in 10 young women at the time that their periods start will get Raynauds. That is not necessarily linked to an autoimmune disease. If we see Raynauds in an older adult, we really get excited and concerned that there may be an underlying, what we call connective tissue disease, like systemic sclerosis. Raynauds is seen in about 90% of patients with systemic sclerosis, so it's a very common symptom and can sometimes lead to even ulcers on your fingertips. This is just a slide showing what Raynauds look like and how we assess it. We look for things called red flags, and that makes us excited and makes us think more vigorously about what's causing the Raynauds. So I mentioned earlier, an older adult. Raynauds in a man is really uncommon, even in a young man. If it's associated with ulcers on your fingertips or on your knuckles, that would make us anxious that this may be secondary to something else. Or if it's associated with dry skin on the sides of your fingers, we may be looking at other connective tissue diseases. And then many other symptoms like rashes, mouth sores, hair loss, joint pain, muscle pain, difficulty swallowing. That's when we take the history from the patient and we figure out whether there may be what we call a secondary cause of Raynauds. There's lots of treatments for Raynauds, and the main ones are self-help, keeping your hands warm. Even in Canada, it can be done. There are hand warmers, there are heated steering wheels, for example. And then we may need to move on to medications, and medications all work to open up the blood supply. And there are a variety of medications that we can use. I've listed some of them here. And if oral medications don't work, we sometimes have to go to intravenous medications. And that would bring you in for up to 4 or 5 days in the outpatient department for that infusion, and really can be markedly beneficial. And that wraps up our discussion about Raynauds for today.